Good afternoon, and thank you for joining us for another edition of Kidney Talks with the GW Ron and Joy Paul Kidney Center, MOTEP, the Minority Tissue and Transplant Education Program, the Pennsylvania Avenue Baptist Church, and blackdoctor.org. My name is Suna Halley, and I am your host today. I'm a program manager at the GW Liver and Pancreas Institute for Quality. Our guest speaker today is no stranger to the show. Dr. Keith Melanson is a professor of surgery at the GW School of Medicine and Health Sciences. He is chief of surgery for the Division of Transplantation at the GW Medical Faculty Associates and director of transplantation and the GW Transplant Institute at George Washington University Hospital. Dr. Melanson, a native of Louisiana, specializes in kidney, liver, pancreas islet, and stem cell transplantation, as well as laparoscopic kidney donation. Among his research interests are minimizing immunosuppression, transplant organ tolerance, racial differences in outcomes of organ transplantation, and stem cell transplantation. Dr. Melanson will be speaking on the 5 stages of kidney disease today. Our panelists will be Dr. Clive Callender, professor of surgery at Howard University College of Medicine, and the founder of MOTEP, the Minority Tissue and Transplant Education Program. Without further delay, I would like to turn things over to Dr. Melanson for his presentation.
Thank you, Suna, for a great introduction, and it is my pleasure to be here this afternoon. And I have given a similar talk in the past about the stages of kidney disease, but today I wanted to add just a little bit of a twist so that we can have a special presentation for Black History Month, because kidney disease, as well as a lot of other vascular problems, are seen more commonly in our community, in the African American community. So again, thanks for your introduction, and let's get started. So the title of my presentation is What You Should Know About Your Risk for Kidney Disease, the 5 stages of renal disease. Next slide. Okay, so I am a transplant surgeon, as is Dr. Callender, and so for us, we wind up seeing patients at the end of their journey for kidney disease, right? They're coming to us because they might need a transplant. That's stage 5. That's end stage kidney disease. But there are 5 stages of kidney disease, and I'm going to go through those stages right now. But like I said, I wanted to focus on the fact that African Americans have a lot more kidney disease than other ethnic groups in this country. African Americans are 4 times as likely to have kidney disease, and that's at every stage. So, we talk about the 5 stages, but African Americans are more than 4 times as likely to have every stage of kidney disease, including end-stage kidney disease. Other ethnic groups like Native Americans and Hispanics also have more kidney disease than white patients. And a lot of this has to do with something that's very, very simple, and that is access to care. Okay, next slide. And when we talk about access to care, I think this is one of the best quotes in history, and it comes from the great Dr. Martin Luther King Jr., when he said, "Of all the forms of inequity, injustice in health is the most shocking and the most inhumane." Access to care is a big, big problem in this country. And again, why I'm so happy to be here with the great Clive Callender, access to care is not what we always think of as what is good access versus what is not good access. In other words, I've done a lot of work in reaching out into the community, not as much as Dr. Callender, but I've done a lot of work in that area. And I can tell you that access to care or health care does not mean that you don't interact with the healthcare industry. or that you don't get to the hospital when you have a problem, or you don't see a doctor. That's not the problem, right? It's not hard in this country to go in and see a doctor or go to the emergency room. That we don't have those sort of issues in this country. What we have a problem with is this longitudinal care, right? In other words, to get plugged into a system. It's when you get plugged into a system that people get the best care. And if you're not plugged into a system, if you don't get longitudinal care, meaning care over time, that's when some of these issues that we are talking about today become a problem. Next slide. All right. One of the issues, and I've had to learn this over the course of my career, which is the fact that as a doctor practicing what we call allopathic medicine in this country, what we learn in medical school and throughout our residency is how to treat sick people. But preventative care is the most important form of healthcare. And preventative care has to do with getting people to change bad behaviors. And that's very, very difficult to do. And one of the hardest things to get people to change is their dietary habits. Because, let me give you an example. Let's say you have a problem with taking illegal drugs like heroin, right? You can get to a point where you have gone through treatment and rehabilitation, and now you don't crave heroin any longer, and you can go on the rest of your life, and you never need to take heroin again. That's great. That's success. But it's not the same thing with food. You always have to eat, right? So you can never get to a point where you're not going to be able to eat. So to change a behavior where you need to continue in the practice, which is eating, is much, much more difficult. And look, as you guys may know already, I'm from Louisiana, and diet is everything there. What we love our food, and I can go into all the examples of the unique and rich history of cuisine that we have there. I've talked about the fact that I love to cook my mom's famous gumbo recipe, although I've made some changes throughout the years. But the point is that we intertwine our dietary habits into our culture, and that combination of our dietary habits and our culture can lead us to make some bad decisions and have bad habits. In other words, we think that we require certain things, and it's a re-education to make us understand sometimes that no, you can have similar taste. Your palate can get the same sort of pleasure from food that is not quite as unhealthy. Okay, so we now know there's a whole science looking into this concept of what we call food deserts, right? And what we have learned is that in certain communities, people have access to only foods that can be less than healthy, meaning very, very high in sodium and very, very high in preservatives. These things are both bad, and they're bad for any person. Any person, I don't care what your ethnic background is. But we, as African Americans, for some reason, and there are various theories, we don't have to get into all of them right now, but we tend to be more salt sensitive. And the major theory is because we tend to come from more temperate regions around the globe. We come from areas that are hotter, and if you come from a hot area in temperature, then you're going to lose more perspiration. And if you lose more perspiration, you're going to have a greater propensity to become dehydrated. So from an evolutionary point of view, there is an advantage to hold on to water. And the only way water moves in our body is it's connected to sodium. So we tend to be more salt sensitive. In other words, if we eat more salt, we hold on to more water more avidly than people that their ethnicity may come from Northern Europe. Okay, so since we are more salt sensitive, if we have problems like high blood pressure, we, more than any other group of people, need to be avoiding salt and avoiding preservatives that have a lot of salts and sugars in them. Okay, so why a food desert's important? Well, all a food desert means is that where you buy your groceries is going to be in an area where you're getting a lot of canned foods, a lot of foods that are made to last on the shelf for a very long period of time, right? Um, it's not normal. People, I remember one of my patients complaining about going to the high price stores and how the food, particularly bread. She would say, "I go to Whole Foods and buy bread, and it goes bad really fast." Well, if you buy food that decays fast, that's because food is supposed to decay fast, right? So if you buy some food and if you buy bread and you put it out and it's just sitting on your table and it's still fine 2 months later, then something's wrong with that bread, right? And that means it has a lot of preservatives in it. And there's a lot of food that have a lot of preservatives. A Twinkie would last for probably 100 years. You probably put a Twinkie out and it probably lasts 100 years because it's all chock full of preservatives. I now work with a lot of millennials and Generation Z people. And so I'm realizing that young people haven't had the same experiences as I. I was talking about a ding dong the other day, and this person didn't even know what I was talking about. So, but the point is, preservatives are problematic as well. And we see more people that live in these food deserts. In other words, there's not a multi-choice sort of grocery chain or store in the region, and therefore they're going more to like a corner pantry sort of place in order to get their food. That's a lot more sodium, a lot more preservatives. There are tricks, even if you live in that sort of area, where you can clean the vegetables, if they're canned, and try to wash away a lot of the sodium. But the point is that these things go hand in hand. Whenever you have people, and numerous studies have been done, that eat more sodium, that eat more sugar, and more foods with preservatives, they tend to have more high blood pressure, more obesity, more end-stage renal disease, as well as vascular disease. These things all go hand in hand. And if you've ever seen me speak before, you've heard I've talked about the three main reasons people have kidney disease in this country: high blood pressure, diabetes, and obesity. Those are three main reasons. And all of those things are seen in higher concentrations in people that eat a lot of salt and sugar and fat and preservatives. Next slide. Okay, so the reason why I always want to talk about the 5 stages of kidney disease, 5 stages, is because the first 3 stages are usually still reversible. So if you get diagnosed early, while you're still in those first 3 stages, you can change your behavior and then reverse the kidney disease. So it's very important to understand that there are 5 stages and that you want to get access. This is what I was talking about earlier. In order to really change your healthcare for the better, this usually is not a one-stop shop. You need to be under the care of someone that is watching what is happening to your health over time. That's what I'm talking about when I say longitudinally, right? You see the doctor makes some changes and then follows you up again after a month or so, sees what happened with those changes, and then follows you up yet again. You need to have ongoing follow-up when there are problems. Next slide. Okay, so what is stage 1? Most people do not even get diagnosed when they're in stage 1 kidney disease. In other words, most of what the doctors look for when you go to the hospital or you go to the doctor's office, they wouldn't even catch stage 1 kidney disease because the blood tests that most doctors are looking at to determine how good your kidneys are working, that blood test is still normal. That's why it says GFR greater than 90. GFR, which is the little calculation that is done to determine how good your kidney functions, and it's done on the ratio of how good your body is at getting rid of the breakdown products of mostly of muscle. That number is normal at stage 1. The only way someone would be able to know if you had any sign of kidney disease at stage 1 is if they did a urine test and they saw that there was an increased amount of protein in your urine. That is an early sign of kidney disease. And this really can also be said about stage 2, because stage 2, most labs would not even flag your blood work as being abnormal at stage 1 and 2. And that's why most people actually don't get diagnosed until they are at stage 3. And stage 3 really means you have a moderate amount of disease. And then stage 4 is really the point of no return. Now, even though that's the point of no return, it doesn't mean that you really should not be under the careful care of a doctor, because a good kidney doctor, and that's called a nephrologist, can keep you in stage 4 for a long time and preventing you from going on to stage 5. Stage 4, you're not going to reverse it, but you can at least stabilize it. And just stabilizing your kidney function for a long time is a huge benefit. The way our bodies work, if any organ system is not working as best as it can, then it puts stress on all the other organ systems, right? So if your kidneys are not functioning well, you wind up having more vascular problems. As you get more vascular problems, you're going to wind up getting more heart problems. That's why people with kidney disease have a lot more heart attacks and a lot more strokes. And then stage 5 is when you normally need what we call renal replacement therapy, which means that you either need to be on dialysis, or maybe you see a doctor like me or Dr. Callender and need a kidney transplant. But those are the 5 stages, and I'll go through them. Next slide. Okay, so like I said, stage 1, honestly, most doctors are going to miss it. That's why, and I tell this to all my patients, you need to be your own best advocate. You need to be looking at your body. No one knows their body better or should know their body better than you should, right? So one of the things you could see at this stage of kidney disease is that when you go to the bathroom and you make urine, it's very foamy. If you notice that, then what you're really seeing is you're seeing a lot of protein in your urine. And usually, even normally, our urine is going to be most concentrated first thing in the morning. So that's going to be your darkest, most foamy urine first thing in the morning. But over time, if you notice that there's a lot more of this foam, a lot more bubbles, and even throughout the day, that means you have protein in your urine. That's called proteinuria. It's the earliest sign of kidney disease, because protein should not get through the kidney. And if it's getting through the kidney, it means that you have a leaky valve, so to speak. And that needs to be addressed because, like I said earlier, you can reverse this damage. Okay? We already talked about the 3 most common causes of kidney disease, but stage 1, usually you can totally reverse. And you might ask, well, how would I reverse it? Well, okay, let's just deal with the most common reason people have kidney disease: diabetes. Okay, so if you're diabetic or pre-diabetic, although you may not have many symptoms, particularly if you're pre-diabetic, an early sign is protein in your urine. So you go to the doctor, and the doctor may not talk about your kidneys, but they talk about the fact that your sugar is a little high, right? They may not think you're at the point of needing insulin, but they've told you that your sugar is high. Well, again, showing the interplay between diet, exercise, and health. If you then, and I've had this happen with patients, I've had it happen with friends and family members, because they've called me and I've told them, I'm like, look, okay, you are pre-diabetic. You know what the best thing to do if you're pre-diabetic? Change your diet. You need to be pulling back on the amount of sugar in your diet, the amount of alcohol in your diet. increasing the amount of water in your diet, and increasing exercise. Dr. Callender for years have been talking about how we need to pursue healthful living, right? Including emotional health, including spiritual health. Well, that's what he's talking about. What he's saying is you need to, this should be a wake-up call, and you need to say, you know what? I could be more healthful in my life, right? So if you take a person who's pre-diabetic and you get them to start doing the things I just said, change their diet, increase their water intake, and increase their physical activity, guess what? Those numbers are going to get better. So as their pre-diabetes goes away, their kidney function will improve. They go hand in hand. So it's a wake-up call, which is why you need to go to at least a yearly checkup, because these are the things that the doctor or the physician assistant should be going through with you. They should be telling you, okay, we're catching this early. That's what you want. That's why you're going to the doctor regularly. You want to catch these issues early. They should weigh you. They should tell you, okay, your optimal weight is within such and such a range, and you need to be shooting for that. This is what happens sometimes also. I've had this happen even with family members. You're not overweight, right? So you're in the right weight range, yet they're telling you that your sugar is a little bit high. In other words, you don't have to be obese to have pre-diabetes or even diabetes. And just because you're not obese doesn't mean you don't have a bad diet. There's a lot of relatively thin people that have bad diets. You still can improve your health by changing your diet and changing your habits. Next slide. All right, stage 2. Okay, stage 2 is just a furtherance of what we were just talking about. I guarantee you, most doctors will still miss that you have kidney disease, even if you're in stage 2. Like I said, the little printout that we get in the doctor's office, the computer will not even flag the fact that your kidney function is starting to decrease a little bit. Again, you being a proponent of your own health, you should keep a log and a record of all of your test results. So if you notice, let's say GFR, your GFR last year was 110, and your GFR this year is 87. Okay, 87, 110, both of them are pretty much a normal range, right? The machine is not going to flag an 87 as being abnormal. But for you, the year before, you were more than 20 points higher. That should alert you. You should ask questions. It doesn't mean that you necessarily have kidney disease, but you should ask the provider a question. Why did I decrease? It could be something as simple as you dehydrated that day. Well, you know what should happen if you're dehydrated? You should rehydrate and retest. Okay? This is the sort of longitudinal care that you want if you're actually having good healthcare access. Okay? But again, the most sensitive thing for early kidney disease, including stage 2, is the amount of protein in your urine. Again, there are healthy reasons why people can have an increase in protein in their urine. You could be a very active person. So people that exercise a lot can have more protein in their urine. You could eat a high protein diet. Some people like to eat a lot of and it could be healthy. You could be eating a lot of lean protein, plant protein, a lot of lean meats. So that's another reason, or a healthy reason, to have high protein in your urine. But again, the question should be asked and the answer should be given, and follow-up tests should be done. In that case, the person should decrease their exercise for a little bit and get retested, or decrease their intake of protein and get retested. Next slide. Okay, stage 3. This is where most people get diagnosed, honestly. If they're following with a physician, they will usually notice that the blood test has really decreased, the GFR. And when the GFR decreases, that's when they become alerted, and hopefully will send you to be under the care of a kidney doctor, a nephrologist. It's at this point that all of the things, all the antecedents to kidney disease need to be addressed. Your blood pressure needs to be well controlled. You need to make sure you're not diabetic or pre-diabetic. You need to change your diet. These are the sorts of things that need to happen. And again, even though this is moderate disease at stage 3, you can reverse it if you change the problems that are leading to the kidney disease. Next slide. Okay, now stage 4, like I said, that might be the point of no return as far as reversing kidney disease, but it can be stabilized. Once again, this is why it is imperative that you have access to the healthcare industry and under the care of a specialist, a nephrologist, because as kidney disease worsens, it accelerates vascular disease. It accelerates the sorts of things that can lead to heart attacks and strokes and premature death. So it's imperative that you're under the care of a kidney doctor. Next slide. Yes, stage 5. And this is how I started to talk. These are the patients that I'm seeing in my clinic. These are people that unfortunately will need either dialysis or transplantation. And again, we are very successful in this country. One of the things that we do really well in the United States is specialty care and the care of people that get to these extremes of needs for healthcare. And so people like me and Dr. Callender, we will perform a transplant in people that are stage 5. But again, what we really want to do is prevent kidney disease, or at least treat it early when it's still reversible, because we don't have enough transplants to go around for all the people that are developing kidney disease. We have an epidemic of kidney disease in this country, primarily because we have an epidemic of the 3 causes of kidney disease. I already told you: high blood pressure, diabetes, and obesity. Next slide. Okay, so I want to leave lots of time for questions, and hopefully there are some good questions out there in the audience, because again, for Black History Month, I wanted to concentrate on the fact that, people that consider themselves African American, particularly in the South, we tend to culturally hold on to habits that, can be classified as bad habits. I'm talking about dietary habits. And we need to change or at least be flexible with these dietary habits in order to be healthier in our lives. Thank you.
Amazing presentation. Thank you so much, Dr. Melanson. Very, very helpful information. If you are just joining our presentation for today, thank you for being here. We are talking about the 5 stages of kidney disease. This is the Kidney Talk with the GW Ron and Joy Paul Kidney Center, MOTEP, and the Pennsylvania Avenue Baptist Church and blackdoctor.org. So we're going to open up to some questions that we received from the audience, more so about Black History Month and kidney disease. One of the questions, Dr. Melanson, is you've spoken about and Dr. Callender. Dr. Callender is our panelist today. He is a professor of surgery at Howard University College of Medicine and the founder of MOTEP, which is the Minority Tissue and Transplant Education Program. So you've talked a lot about how close diet is connected to kidney disease. What are some things that, individuals who are watching this can do to supplement their diet that increases kidney health?
That's a great question. And of course, it really matters where you are on that continuum. Your diet has to become a lot more restrictive as you get closer and closer to stage 5, or once you're on dialysis. But let's just say we're in the earlier part where these interventions can really prevent a deterioration of your kidneys. Well, what you should be trying to do, it's very much in vogue today to try to eat a more plant-based diet. And what most people mean by that is decreasing the fatty meats and heavy meat proteins or animal proteins, and increasing fruits and vegetables. And the reason is when you eat meat, remember I told you that your creatinine is the amount of the breakdown products of muscle, your own muscle, as well as the muscle of the animals that you eat. That all has to be processed through the kidney. So if you want to increase the health of your kidneys, you want to try to decrease the work your kidneys need to do to metabolize things like animal proteins. So one of the first things you can do is to transition to eating a lot more fruits and vegetables and a lot less animal meat. Even if you still will take protein, animal protein, there are much leaner forms of protein, like fish, particularly baked fish and other seafood, or very lean cuts of meat. Okay, so those are the things that you could do, the changes that you could make that increase your kidney health. Now, one of the things I've already mentioned is water intake. Again, I'm not talking about end-stage kidney disease, because once you get to stage 5, you gotta decrease the amount of fluids you take in, just because your kidneys are not working well. But if you're earlier, stage 1, 2, 3, even early stage 4, then you want to increase the amount of water you take in, because that's going to increase the ability of your kidneys to filter out the toxins in your body. As your kidney function decreases, the toxins inside of your body increase. So you want to drink more water, make more urine, and flush out these toxins. These are the two things that that you can do to change your diet. Now, and I've already talked about decreasing sodium intake and preservatives. Farmers markets is a great place to go, because you're getting fresh fruits and vegetables. In the grocery store, you want to go to the fruit and vegetable aisles rather than spending a lot of time buying pre-packaged meals or canned vegetables. You want to try to do fresh vegetables whenever you can. So decreasing salt, decreasing sugar, decreasing preservatives, decreasing red meat. These are all things that you would do to increase your kidney health.
We have another question, Dr. Monson and Dr. Callender, related to potassium. Is potassium good for your kidneys and high blood pressure? And, they were given 2 different answers, I guess, from 2 different doctors. So I guess you guys will be the tiebreaker.
Go ahead, Dr. Callender. This is right up there.
Yeah. That's interesting, because we know that potassium decreases the blood pressure. But we also know that if you want to kill somebody, you give them potassium. So how do you reconcile this? The way you do it is to appreciate that if you've got good kidneys, you can eat bananas and orange juice, okay? But if you don't have good kidneys, then that is toxic to you. So that, yes, it is true that you can have 2 answers. One is that if you got good kidneys, potassium is good to lower your blood pressure. But on the other hand, if you're in stage 5, then potassium is likely to kill you. So that's one way of answering that particular question.
Thank you so much, Dr. Callender. At the beginning of your presentation, Dr. Monson, you mentioned that a lot of folks will go into the doctor's office and will have stage 1 and it will not be detected. If I hear this podcast and I want to go to my doctor and say I want to make sure that you're catching everything, what can I tell the doctor to make sure that they're checking from as early as stage 1?
Yeah, no, it's a great question, Suna. And one of the things that patients should do when they go to their physician and they want to know about their kidney health is they should just forthrightly tell them, say, hey, I just want to make sure my kidneys are okay. Do I have protein in my urine? Or sometimes the doctor will not have even asked for a urinalysis. So the patient should volunteer. The patient should say, you know what, I've been reading, and I know that the best way to catch early kidney disease is to find out if I have protein in my urine. So I really want you to test my urine and see if there's protein in my urine. And then, now, when you go to the doctor, you can go online and see all your lab results. Mm-hmm. Right? I have people calling me. I have this joke going with my wife people call me from all over the country. They've got their lab results from visiting their doctor. They haven't even talked to their doctor yet, and they're calling me.
That's right.
So we all get into computer, and we can look at
Yeah.
our lab results now in real time, right? Because those labs release the labs to the patients before they even tell the doctor. So sometimes the patients have the results before the doctor. So what you want to see, because you're an expert consumer, right? I mean, you have people that are experts on purses, they're experts on shoes, but they're not expert on their health, right?
Yeah.
Just like we want to be experts on where to buy the best shoes,
Yes,
and the best purses, we should be experts on our health. So do
Yeah.
your research. But here's what you do: you go in, look at it, and I mean, because the lab usually will say if anything is abnormal, right? So if you see something abnormal, you should call your doctor or text them or the physician assistant, because that's what a lot of doctors' offices have. Your questions will go to the physician assistant, and they have to answer you. But that's what you need to be proactive
Yeah.
about getting good health care. So ask those questions. But so to your point, Suna, you're going to make sure you get a urinalysis, number one, and then you're going to check the results and see if your protein level is high. It's a very simple, cheap test to check for protein in the urine. And if it's high, you want to ask your doctor about it, but I'm already giving you the answer. And the answer is you need to do some changes
Yes.
in your own life to try to get that protein to go away. And like I said, most commonly, that's going to be drinking a lot more water and making sure that anything that could lead to kidney disease, like you want your blood pressure to be normal. We've talked about this before. What does normal mean? So that top number should never be above 140, right? That top number should be 130 or lower, right? That's really, to make sure your blood pressure is fine. And that's the thing that people don't get. They think, okay, my top number is okay. My bottom number is a little high. It's okay. No. Both of those numbers need to be in the right range. So that top number needs to be below 130 and the bottom number needs to be below 80, right? So both of those numbers have to be in the normal range, right? Because if the top number is okay, but the bottom number is high, you still have high blood pressure, or vice versa. So both of those numbers need to be fine. And then another lab that you're going to look for in your blood work is your glucose. Your glucose should be normal, right? So if that glucose is normal, it should be below 120 milligrams per deciliter. So you need to make sure that glucose is normal. Again, sometimes people will see, even doctors, oh, it'll be a little high. Oh, it's a little high, right? 120 is normal or 118 is normal. You were 125. Just a little high. No. That's a problem. A normal functioning pancreas in a person without diabetes will always keep your sugar under control. I don't care if you just had a bite of the best pie or cobbler or whatever you like, whatever sweet you like to eat. If you just ingested it, your sugar in a normal person will be normal. And if it's high and you go, oh, I just had a donut. It was because I just had a donut. No. That's not normal, right? So if your sugar ever goes high, it means that your body is having a little bit of trouble in digesting that. And you're on the road to diabetes. You may not be diabetic, but you're on the road. And that should be an alarm. And what I'm trying to get people to understand is that's what preventative medicine is. You want to deal with problems before they become an issue. That's when you're in your best state of health. When we have to deal with people after they have the problems, that's when it becomes a lot more dicey, a lot more difficult to deal with.
Dr. Malonson and Dr. Callender, you've spoken about going in, checking your glucose and your high blood pressure. How often should someone be checking their glucose and high blood pressure? Should it be at their yearly visit? Should they still be checking their high blood pressure daily, weekly? What is your suggestion?
Well, I'm glad you asked that question, because one of the things that has troubled me recently is that a number of people who are over the age of 50, and one of the things that Dr. Malonson mentions is that there's a high-risk group. And the high-risk group not only is the people who have the diabetes and the high blood pressure and the obese, but also people who are over the age of 50, particularly if you're Black. And a lot of people who go to get their annual physicals the doctor does not do a urine for protein. And therefore, this is the time, if you're over 50 and you go get your annual checkup and they don't check your urine, ask them to get your urine checked. If there is protein, don't accept the fact that, oh, it's okay, you can have some protein in your urine. No, this means if you have protein in your urine, you need to see a nephrologist. And somebody asked me if, well, suppose my doctor says, no, you don't need to see a nephrologist. How do I get to see a nephrologist? It's easy for people who are in the medical profession to say, okay, just find a nephrologist. And so sometimes the question is, how do you get a nephrologist? Well, of course, if you belong to any group like George Washington, you'll know how to get a nephrologist, or your primary care doctor should be able to get a nephrologist for you. But don't let it suffice for them to say to you that, oh, you have protein in your urine. That's okay. It is not okay. And this is the time when you need to get to see a nephrologist to find out how you can change that protein in your urine to no protein in your urine, or prevent that from becoming from stage 1 to stage 5.
Thank you so much.
And one more thing, Suna. I totally agree with everything Dr. Callender said. Of course, he's right. And, in addition to that, one of the things I tell people all the time, you should have a blood pressure cuff at home. They sell them now in the drugstores, and they're great. You just stick your arm in, press a button, and it tells you your blood pressure. There's no excuse why everyone should not have a blood pressure cuff, and you should check your blood pressure every day. Actually, more than once a day, because you should know what your normal blood pressure is in the morning. You should know what it is in the evening, right? And if you're in a higher risk group, just like Dr. Callender said, then you need to heighten your alertness about your health, right? If you're 25 years old, you still need to check things, but you don't have to be as vigilant at 25 as you have to be at 55. So Dr. Callender is totally right about that. But a blood pressure cuff, you should have that. You should have that in your home. And if you have an actual diagnosis like high blood pressure or diabetes, you should be seeing your doctor not once a year. You need to be getting regular follow-up, because you're definitely in a much higher risk group. People that have these problems, and this is one of the issues that we've seen in the American healthcare system. People think, oh, I'm under the care of a doctor. No, it's or like we always have this bet when I go out to outreach, and the bet always is, I bet the person that has the highest blood pressure of the day will be under the care of a doctor, number one, and will be on blood pressure medicine, number two. And they always are. So what does that tell you? That tells you we get this false sense of, I'm okay, I already have a doctor, I already have blood pressure medicine. No, you're only okay if your blood pressure is normal, right? Yeah. I don't care if you got 3 blood pressure medicines and you take them when you feel like it. No, that's not okay.
Mm-hmm. And you guys made a great point as well. It's about knowing yourself and owning your health, so that when you go into the doctor's office, you can say, hey, over the last week, 2 days, I ate this and I did have blood pressure or whatever. That's what the doctors want to hear. I feel like as a patient, it's best to own your health and know exactly what's going on before you step into the doctor, so that you can come to a solution together on how to go forward. We have another question.
But wait, one more thing, Suna. So to your point, because this is a problem, and I see this a lot with particularly younger males. The doctor can give you a medicine that may not work well for you, which is okay. So you take the medicine, it doesn't work well. You got to tell them, hey, this didn't work well for me, right? I need something else, right? This is not a good medicine for me. And there's all sorts of side effects that can happen to people. And it just so happens that you have a problem with that particular medicine. But the only way the doctor's going to know is you have to tell them. And sometimes people are uncomfortable talking about things. Like for young men, a big one is impotence, right? So guess what happens when you give a young man a medicine that makes him impotent? He doesn't want to take it, right? So so he needs to go back to because you know what happens? They just stop taking it. and they just,
Mhm.
they're like, I don't want to go see that doctor anymore. But they're only doing themselves a disservice,
Yeah.
right? They've got to go back to the doctor and say, hey, look, this medicine made me impotent. I need something else,
Yeah.
right? And the doctor will work with them. But that's what we have to be. We have to be open and honest and tell the doctors when we have problems with what they're trying to get us to do.
What does impotence mean?
Oh, that's a good point, Dr. Callender. So, inability to have sex is for a man that's impotent. And this can happen to young men when they get blood pressure medicine. But again, the good thing about blood pressure medicine, there are like 14 different types of blood pressure medicine. So just because one medicine does that, don't think that any medicine you get for blood pressure is going to cause that problem. So good point, Dr. Callender, to clarify. Yeah, in we're bad about this in medicine. We use words sometimes that people don't really understand.
Yeah.
And sometimes you got to break it down.
Yeah, thank you for clarifying. We do have a question from the audience that I want to address before we move forward. Is kidney disease hereditary? Meaning, can I get kidney disease from a family member, or is it something that comes down through generations?
Go ahead.
Well, kidney disease definitely can run in families, and you could have hereditary problems. But kidney disease can run in families for different reasons. So, you may have a genetic issue that's passed on to many members of the family. That's an hereditary problem. It's in the genes of the people in that family, right? So that's one way that families can have kidney disease. But you can also have things that run in families that cause kidney disease. Doesn't mean that everybody is genetically predisposed to kidney disease, but it can mean that everyone in that family that may have a predisposition to high blood pressure, particularly eating the sorts of foods that people in that family eat. We see this all the time. In other words, people think, everybody in that family is overweight because they have a gene for being overweight. No, that's not usually the way it happens. What happens is what people are in that family are doing culturally is passing on to all the members of the family because they're all in the same culture. And you have to break free in order to change your behavior, and you can have different health, better health. Okay. But yes, there are definitely hereditary diseases, and usually those things will be diagnosed. I mean, now we have genetic testing that can make things easier. We actually test people in our clinic to see if they have genes that can actually lead to kidney disease. But even in that scenario, doesn't mean that there's a gene in that family and every single person is going to get kidney disease.
Yeah.
No. Because there's a difference between what we call genetics and epigenetics. And epigenetics is much more important than genetics. And guess what epigenetics has to do with? Behavior, right? I've oftentimes, I think even on this program, I've talked about members of my family who everyone in one group has high blood pressure and diabetes, and then some people don't. But the behavior of the people that don't, marathon runners, vegetarians, vegans, same family, everybody else in the family is eating a Louisiana diet and overweight and have diabetes. And two members of the family are in perfect health and they're 65 years old and look like they're 30. What's the difference? Same genes, same mom, same dad. The behavior is different. So you're not locked into a life of whatever the diseases are in that family unless you have the same behaviors. And people can still change, even genes, and we call it penetrance, right? Just because you have a gene doesn't mean the gene is turned on. You can turn it off if your behavior is different. Okay?
Yeah, I really like what you said, Dr. Monson, because even though something could run in the family, you have the autonomy to change that. Only you can change that by your behaviors. I really like that. Let's see, we have one more question. I think this will be the last. Can you have stage 1 or stage 2 kidney disease with the absence of proteinuria, but with a structurally abnormal kidney?
That's a good question. And And I guess technically you could, but usually if you have some sort of structural abnormality, like I'll give you a common scenario where one kidney is a lot smaller than the other, right? So, or your kidneys are small. So, in that scenario, you could have normal labs for a period of time, and then they can start to fall off later in life, right? So people are born with an issue. They could have had these small kidneys for their entire lives, and it doesn't present until they're in their fourth or fifth decade. However, even in that scenario, the way that your body, because the body is a miraculous thing, right? So your body can accommodate almost anything. And what the body will usually do in the scenario where you have something wrong with your kidney, but your labs look really good, the way the body usually deals with that is by doing what's called hyperfiltration. And meaning that, your body, your kidneys are too small for your body, the body will push the blood through faster. But the most common thing to see in a person that's hyperfiltrating is proteinuria. Mm-hmm. So you normally will have some protein in that scenario. But, one of the things I learned a long time ago in medicine is there's always an exception to the rule. So I'm sure it is possible to have abnormal kidneys and be in stage 1 or 2 and not have protein in your urine. I'm sure that's possible, but it's not that probable. Usually people have some degree of protein in their urine.
Awesome. Dr. Melancon, thank you so much for your timely presentation, especially during Black History Month. I think this is a great time to share about kidney disease and also how to prevent it. Dr. Callender, thank you so much for being an amazing panelist. And for all the watchers, thank you for joining today for Kidney Talks with the GW Ron and Joy Paul Kidney Center. We will see you in 2 weeks on Friday, March 10th at 2 p.m. for another presentation on kidney health and wellness. Until then, happy Black History Month. Stay well and be blessed.
Thank you.